Good morning, students. Here we come up with the knee joint part 2, articulating surfaces. So therefore, in the part 2 of the articular surfaces knee joint, we will discuss the tibial condyles today. Now in the tibial condyles, please draw in this way. This is how the tibial condyle, we have to draw medial and lateral. So therefore, this is the superior surface of the tibial condyles. Now here, this will be the medial condyle, this will be the lateral condyle. And therefore, as we draw this, we have to mark that the superior surface of the medial and lateral condyles of the tibia will be concave. So these two surfaces will be concave. And the superior surface of the tibial condyles, both medial and lateral condyles, will be shallow as compared to the convexities of the medial and lateral condyles of the femur. But this concavity of the tibial condyles will be made deeper by attachment of the two menisci. Now these two menisci, which are semilunar in shape or ovoid or circular in shape, as I will discuss with you, these two menisci, they are the medial and lateral menisci which are attached on the superior surface of the medial condyle as well as lateral condyle of the tibia. Because of this menisci, the shallow concavity of the medial and lateral condyles of tibia will be made deeper. This is first sentence. So therefore, how this shallow concavity will be made deeper is because of attachment of semilunar cartilages, and these semilunar cartilages are known as menisci. So therefore, the two menisci, we can draw the two menisci in this way. We will use blue color. So therefore, these are the menisci. Now, please mark one thing, that menisci are attached on the peripheral 2/3 of the condyles. Peripheral 2/3 of the condyles in this manner. So this is the attachment of the menisci. So if I color this, this will be the medial menisci. This is the medial meniscus which is attached on the medial condyle of the tibia. It is attached on the peripheral 2/3 margin. Same way, lateral meniscus. So therefore, the lateral meniscus will cover, now here, the lateral meniscus will cover the peripheral 2/3 of the lateral condyle of the tibia. Now, after coloring these two menisci, the medial and lateral menisci, these two menisci will help in deepening the shallow concavities of medial and lateral condyles of tibia. Second point, now, after marking this menisci, please mark here, this will be the medial meniscus, and this one will be the lateral meniscus. The shape of the medial meniscus is ovoid in shape. The shape will be ovoid, and the shape of the lateral meniscus is circular. This can be asked as one mark question answer or an MCQ. Second important point will be, the first point was the shape of the medial meniscus is ovoid and the shape of the lateral meniscus is circular. Now in some textbooks they have mentioned that this medial meniscus is ovoid or semilunar in shape. Semilunar. And lateral meniscus of course is circular. Now second important point will be, the medial meniscus is more lengthier anterior-posteriorly. That means anterior and posterior, the medial meniscus will be more lengthier than the anterior-posterior margin of the lateral meniscus, as you can see from the diagram itself. So this point is also equally important. The medial meniscus anterior-posteriorly, it will be elongated rather than the lateral meniscus, which is not as elongated anterior-posteriorly, because the lateral meniscus is circular. Two important points. Once again I'll repeat, the medial meniscus is ovoid in shape or semilunar in shape, lateral meniscus will be circular, and the medial meniscus will be lengthier anterior-posteriorly than the lateral meniscus. So, in the articulating surfaces of the tibia, we are discussing the tibial condyles today. So, therefore, the menisci will play an important role in deepening the concavity, shallow concavity of the medial and lateral condyles of tibia. Here we finish our first important point of the menisci. Now, this is tibia. If you compare this with the condyles of femur, which we have studied in the previous segment, please note down that in the condyles of femur, the lateral condyle of femur will be more stout and more heavier than the medial condyle. The lateral condyle of femur, because it will be more stouter, it will be more heavier than the medial condyle of femur, because the lateral condyle of femur will carry maximum weight transmission from the hip joint to the knee joint. So the maximum weight transmission right from the hip joint, it will be carried to the knee joint and downwards through lateral condyle. That is why lateral condyle of femur will be stronger than the medial condyle of femur. Although the medial condyle of femur, you will see that it is projecting more medially, but then also lateral condyle of femur will be stronger and stouter than the medial condyle of femur, because maximum amount of weight is transmitted from the hip joint to the knee joint through lateral condyle of femur. Here you compare this with the medial and lateral condyles of tibia, where we know that the medial surface is ovoid semilunar, anterior-posteriorly the medial meniscus is more lengthier than the lateral meniscus, and the lateral meniscus is circular. So these are the two differences between the condyles of femur and the condyles of tibia, which you need to note down. After finishing this first sentence here, we will move on to the second part. Now in the second part, what you need to show in the articulating surfaces of the tibia will be, where my hand is there, this is the intercondylar area. So in the intercondylar area of the tibia, there will be anterior intercondylar area and posterior intercondylar area. These two lighter lines which I have drawn, they are the anterior and posterior intercondylar areas of the tibia. So therefore, exactly in the middle, there will be intercondylar eminence. So what I have drawn here is intercondylar eminence. Now present on this intercondylar eminence will be the medial and lateral tubercles. So therefore, you can just mark here, these structures will be known as intercondylar eminence. And these intercondylar eminence will present as medial tubercle and lateral tubercle, present in between the medial and lateral condyles of tibia. And remember, this is the superior surface. Here, these two important areas, this area is called anterior intercondylar area, this is posterior intercondylar area. So therefore, here you have to show three markings. Those three markings will be the marking of anterior horn of medial meniscus, anterior horn of lateral meniscus, and anterior cruciate ligament. Three structures over here in the anterior intercondylar area. Similar three structures will be present in the posterior intercondylar area where my hand is there. That will be posterior horn of medial meniscus, posterior horn of lateral meniscus, and posterior cruciate ligament. But what will be the sequence of the attachment? The sequence of attachment in the anterior intercondylar area from anterior to posterior. This is anterior, this is posterior. So anterior to posterior in the anterior intercondylar area, please draw the sequence in this way. It will be anterior horn of medial meniscus. So first we will draw here. This will be anterior horn of medial meniscus over here. This anterior horn is ending over here. Then there will be presence of anterior cruciate ligament. Anterior cruciate ligament. And the third structure, most posteriorly in the anterior intercondylar area, will be anterior horn of lateral meniscus. So therefore, this anterior horn, we will see that it will end in this way. This anterior horn. So therefore, this will become anterior horn of lateral meniscus. In this way, these three structures are complete. So therefore, this is the anterior horn of medial meniscus, anterior to posterior. Then there will be presence of anterior cruciate ligament, and this structure, third structure, most posterior, will be known as the anterior horn of the lateral meniscus. These are the three structures which are arranged anterior-posteriorly in anterior intercondylar area, which you need to draw and mark it in sequence. Please remember the sequence. This will stay as it is, and this short format is asked in one more question answer in MCQs. So therefore here we will mark on this side this first structure. The first structure will be anterior horn of medial meniscus. I hope you are seeing this. Then number 2, the second structure here, please mark it as anterior cruciate ligament. Then number 3, the third structure over here, please mark it as anterior horn of lateral meniscus. So anterior horn of lateral meniscus. These are the three structures, anterior to posterior. Similar three structures we have to mark here in the posterior intercondylar area from anterior to posterior, and those three structures will be the first structure. So here we will mark the first structure will be this is the posterior horn of lateral meniscus. So therefore the lateral meniscus will end like this, in this way. Posterior horn of lateral meniscus. You start from this. So therefore here we are going to mark, let us mark here, this will be structure number 4. In sequence we are going from anterior to posterior. Now 4, 5, 6 will be the structures in posterior intercondylar area. So this will be the posterior horn of lateral meniscus, structure number 4. Then we will mark structure number 5. That structure number 5 will be posterior horn of medial meniscus. So therefore this medial meniscus will end here in this way. This is how the medial meniscus will end. And here we are drawing posterior horn of medial meniscus. So therefore we are going to mark here this structure. This is structure number 5. So we are going to mark this structure number 5 as posterior horn of medial meniscus. And the last structure here will be this structure, which will be known as the posterior cruciate ligament. Such as this is anterior cruciate ligament, this will be the posterior cruciate ligament, structure number 6, posterior cruciate ligament. These are the 6 structures which are attached in the anterior and posterior intercondylar area, starting from anterior to posterior. Please remember the sequence. These structures are asked in practicals also, they are asked in Viva also, they can be asked in one mark question answer also, they can be asked in MCQs also, and you need to mention this in the articulating surfaces of the knee joint in tibial condyles. Please mark these structures, remember it from diagrammatic point of view. If you remember it in this way, it will be very easier for you to understand and remember. So anterior intercondylar area, anterior to posterior, the first structure is anterior horn of medial meniscus. Second structure is anterior cruciate ligament. Third structure will be the anterior horn of lateral meniscus. Same way, the remaining 3 structures in the posterior intercondylar area from anterior to posterior. Structure number 4. If you take this sequence 1, 2, 3, then structure number 4, the most anterior in the posterior intercondylar area will be the posterior horn of lateral meniscus. Then structure number 5, posterior horn of medial meniscus. And structure number 6, posterior cruciate ligament. So here we end the second phase of the articulating surfaces of tibial condyle. First was we have discussed about the menisci and the area of the medial, the shape of the medial and lateral condyle of the tibia. Second is you have to discuss these 3 structures. 3 structures in the anterior intercondylar area, 3 structures in the posterior intercondylar area, total 6 structures which are attached in the anterior intercondylar areas of the anterior and posterior intercondylar areas of the tibia. This is the second phase. And then after finishing this, third phase will be, remember we are discussing the articulating surfaces. So the third phase is patella. Now in case of patella, the patella which is situated anteriorly in front of patellar articular surface of the femur. For the patella, what you need to discuss will be, if we just come on this side, please come on this side. in case of patella, you have to write simple few points, and those few points will be the patellar articular surface will articulate with the patellar articular surface of the femur. So the posterior surface of the patella will articulate with the patellar articular surface of the femur, and during extension of the knee joint, when the knee joint is extended, the patella will move upwards and laterally. So during extension of knee joint, the patella moves upwards and laterally, and the lateral displacement of the patella, is prevented by two factors. That is what you need to mention. During extension of the knee joint, when the patella moves upwards and laterally, this lateral displacement of patella is prevented. Here I put in a cross so that it is known as prevention. This lateral displacement of patella is prevented by two factors, and those two factors will be factor number 1, Bonney factor. What is this Bonney factor? The Bonney factor is the lateral articular margin of the lateral condyle of femur is more deeper than the medial articular margin of the medial condyle of femur. So the lateral articular margin of which surface of femur? Patellar articular surface of femur. The lateral articular margin of the patellar articular surface of femur is more deeper than the medial articular margin of the similar surface of femur. So because it is deeper, it will prevent the lateral upward and lateral displacement of the patella during extension of the knee joint. This is the Bonney factor, which will prevent the lateral displacement of patella. Which is the second factor? The second factor is muscular. As the first is Bonney factor, the second is muscular factor. That muscular factor will be the attachment of vastus medialis muscle. The vastus medialis muscle is attached on the medial upper two-third of the margin of the patella, medial border of patella, upper two-third, whereas the vastus lateralis will be extended only in the upper one-third of the lateral border of patella. So as the vastus medialis is attached more upper two-third of the medial border of patella, it has a tendency of keeping the patella fixed in its position, or it has a tendency of pulling the patella more medially, which will prevent the lateral displacement of the patella. So please note down, these are the important vital points which you need to mention during the discussion of the articular surfaces of the knee joint, in which you have to mention these 2 points. And these 2 points are often asked in Viva also. Bonney factor and muscular factor, which will prevent lateral displacement of patella during extension of the knee joint. Then comes the last. Patella is a sesamoid bone. You need to mention these 2 points also. Patella is a sesamoid bone, and it will ossify in third year of the life. It will ossify from a single center. And since it is a sesamoid bone, it is devoid of periosteum. It does not have any periosteum. So therefore, a fracture of patella, it will be difficult to heal. And in the last, you can mention that patella is not essential for the movements of knee joint. It is never essential for the movements of knee joint. Even if the patella is removed, then also the knee joint movements are possible. So here we finish the articulating surfaces of the tibia as well as the patella. Coming up in the next segment are ligaments of the knee joint. Thank you very much.